How's it going, YouTube? Welcome back. If you haven't seen my content already, I focus on making complex medical issues simple and to the point. Today, we're gonna talk about cold sores, what causes them, what are the symptoms, how is it diagnosed, and ultimately, how is it treated? Let's dive in. Whether you call it a cold sore or a fever blister, this skin manifestation is caused by the herpes simplex virus. On top of talking about the symptoms, how we diagnose this, and the treatment, we're also going to talk about 3 fun facts right now and then 3 myths at the very end, so stay tuned. In the United States, it is estimated that around 50 to 80% of people have oral herpes, and some countries are actually hovering around 90%. Think about that. Oral herpes is actually most commonly spread through family members, so if you have that aunt or uncle or grandparents and you were freaked out by them kissing you, that may have been warranted. Fun fact 3, weirdly enough, during childbirth, if the mother has genital herpes, it is possible for the mother to give this herpes to the newborn when the newborn exits the vaginal canal, and that's called neonatal herpes. That wraps up the 3 facts. Remember to stay tuned at the very end and we'll talk about 3 myths of oral herpes. So jumping right in, how do you get the herpes simplex virus that causes those cold sores? Most commonly, you get it from oral to oral contact, meaning you've been exposed to infected cold sores, saliva, or skin around the mouth. There are other ways, but we're not going to talk about those today. Interestingly enough, you could either be symptomatic or asymptomatic and still spread the disease. Meaning whether you have a cold sore or not, you can still spread the disease, although it is most commonly spread when somebody does actively have a cold sore. Next, once somebody is infected with the actual virus, without going into too much medical jargon, they're either going to have a primary infection or they'll go into a latent state. In the latent state, the herpes simplex virus enters a sensory nerve ending and travels to the sensory ganglia. A sensory ganglia is a collection of cell bodies of neurons. You may be thinking, what the heck is that? It's not very important. What is important is knowing that the herpes simplex virus likes hanging out there for the rest of your life, and every once in a while it will rear its head in the form of a cold sore. Or you may be asymptomatic. If somebody develops a primary infection, remember a primary infection is when somebody's exposed, infected, and then has symptoms within a matter of days. It can be absolutely awful. On top of having a cold sore, some people will have fevers, severe sore throats, severe fatigue, and even headaches. After this though, remember the virus hangs out in that sensory ganglia and every once in a while it can rear its head in the form of a cold sore. Or you could ultimately be asymptomatic for the rest of your life. When it comes to the cold sores, people can have numbness, tingling, burning, and pain around the vermilion border hours to days before the actual vesicles or blisters pop up, and then it takes around 5 days to a week for it to crust or scab over. I get the question a lot, what can cause an oral herpes recurrent outbreak? Many things can cause it and it's still being studied, but for a lot of people, different things that can cause it is emotional stress, a physical injury, a recent illness, menstrual cycle, and also intense sunlight can spark an oral herpes outbreak for some people. Alright, so the question is, how do we exactly know that the cold sore is actually due to the herpes simplex virus? The best possible way to diagnose this is to do a PCR or a viral culture of the actual cold sore, send it off to lab and get that confirmation. There is blood tests that we can get, but the problem is with blood tests is, again, 50 to 80% of people in the United States are positive for HSV1, so that won't be specific enough to actually know that this was actually caused by the herpes simplex virus type 1. And that's one reason why we don't screen for HSV1 is because most people are positive, asymptomatic, and there's no cure. So the big question is, how do we treat it? We treat it simply with antivirals, whether that's acyclovir or valcyclovir or any other antiviral regimen, but those are the 2 most common ones. And it also depends on whether it's the primary infection or the recurrent infection. If it's the primary infection, the treatment regimen's usually longer. For example, Valtrex you do for like 7 or 10 days. And you want to start it within 72 hours of actually having the symptoms. Meaning if you have pain or tingling before the cold sore pops up, you want to start the medication immediately. The same goes for the recurrent episodes. If you have a recurrent infection and you notice that you're having pain or burning, you want to start it right away, preferably within 72 hours. Remember that it doesn't cure herpes, but it does speed up recovery to make it a lot faster and make the symptoms a lot more tolerable. But these treatment regimens frequently change, so definitely check in with your provider and get the most up-to-date information. Some patients will have frequent episodes or real severe symptoms. In those cases, they can be started on suppressive therapy. Suppressive therapy is taking a medication like acyclovir or valcyclovir every single day to prevent symptoms. But you have to weigh the risks and the benefits because this isn't a benign therapy and could cause adverse side effects in some people. All right, last but not least, the 3 myths that I promised you. Myth number 1. If you have herpes, you'll have symptoms. That is actually false. Only 1 in 5 people who are positive for HSV1 actually have cold sores. So don't be judgmental about people who develop cold sores because you just might be positive yourself. Myth number 2. Herpes is curable by eating different foods, taking different herbs or vitamins. This is false. Herpes is not curable yet. Myth number 3. Herpes simplex 1 only affects the mouth and herpes simplex 2 only affects the genitals. Again, this is false. Most commonly, HSV1 affects the mouth and most commonly HSV2 affects the genitals, but HSV1 can also affect the genitals, although rare. Well, that wraps it up. We just talked about oral herpes in a nutshell. If you have any questions or concerns, please don't hesitate to leave a comment below. Also, don't forget to like and subscribe if you like this content. Otherwise, take care.